Hi, it's Jessica DaMassa with WTF Health. I'm here at the HISA studio in Australia, and joining me right now I have Lucien Engelen. He is the CEO of Transform.Health and also the global strategist for digital health at the Deloitte Center for the Edge. Lucien, it's so great to see you here.
It's great to be back again, to see you again.
Thank you, you're so sweet.
Thank you.
So I want to pick your brain about the future of health because I refer to you oftentimes as somebody who's a futurist as far as this space is concerned because you've really studied it. So, I mean, one of the things that you have regularly spoken about and your book is about this movement from values-based healthcare to value-based care. Or just, excuse me, value-based health.
Health, absolutely.
So what does that mean, value-based health? And how is this different than the way that we usually think about value-based care?
Yeah, I think it's the first one is the transition going away from healthcare.
Okay.
Because healthcare is about fixing stuff, right? At least for those conditions that you can fix. The other thing is the preventional part, that in the Netherlands, for instance, is 94% of all the expenditure is being put into fixing stuff. And we know that 50% is preventable. So what would happen if we use technology to get more on a hold on that preventional aspect of it and make sure that people do not get sick in the end of the day? And I know this is about behavioral science and changing lifestyle and these kind of things as well. But I really think that for the first time in history, we're on the brink of using that technology to make these things happen actually. And then we need to transition also in reimbursement systems into let's pay for people that stay healthy. And I think it was like 4,000 years ago, the physician of the Chinese emperor was being paid for every day the emperor was not sick.
Oh, hey.
So this is like flipping around. It's a Copernican moment. So
oh my God! So yeah, talk about the Copernican moment because I love this. This is in one of the talks that you gave. Talking about how instead of realizing that the Earth was not. The sun was not revolving around the Earth, but instead the Earth was revolving around the sun. And so in healthcare, what is this realization going to be?
Yeah, that's the reason and the way that I refer to that is that the patient now circles the professional. And if this Copernican moment in health happens, the professionals will circle the patient in the end of the day, and maybe even the citizen in the end of the day from this preventional aspect of it. So the technology is going to make sure that we are able to delocalize healthcare, so to deliver it in a different place. It's going to be democratized because patients, citizens have more of their own data and they will give a subscription to the professional. It's becoming digital, not only from a technological standpoint, but also in terms of the speed that things are happening. And there's also a lot of dollars coming into it from different new players that got very deep pockets and want to enter the health arena because healthcare still is pretty regulated still.
Okay, so those players that you're referring to in a sideways way are like the Amazon and Google and Apples of the world, right?
Yep.
Now, do you think that this is going to help speed up change in the industry? Because you've been somebody who's been working on the digital transformation piece of healthcare for a very long time. Do you think we're at that tipping point finally where we're going to start really moving into this decentralized, democratized, tech-enabled system that you've been talking about for these years? Are we close?
I think we're close. We're not there yet. The subtitle of my book is called The End of the Beginning, referencing Churchill in a totally different context, of course, but I think we're just nearing that now. The technology is in place, the science kicks in, people know that it's available and they want to use it, and also from a consumer perspective, and I'm the last one to say that a patient is a consumer, but also a patient has consumer aspects.
Yeah.
Let's be honest, if I order something at Amazon at 10 a.m., I get grumpy if it's not being delivered at 5 p.m.
Right.
And then all of a sudden you want to use the healthcare paradigm, and then it gets you waiting like 4 or 5 weeks. That's going nowhere. So this is the tipping point that I think we're nearing. These new companies have a different user interface. They are more speedy and they have investments that they make into it, and I really do think that helps. Let's be honest, change never came out of a sector itself. It always came from outside in. Taxi branch with Uber, we've seen the things with hotellerie with Booking.com, Airbnb, these kind of things. So we needed an outside push and actually to be targeted from outside in.
Do you think, are the healthcare incumbents taking this threat seriously enough? Or are they kind of like, yeah, this will never work because of how regulated healthcare is, and a lot of times because the payment model is so entwined, depending on what country you're in, it's either entwined in the government in one way or another, or it's entwined in health insurance plans that often have a lot of sway because of the amount of money that they control. So, do the tech companies really have the capacity to tip that over?
So the title of my keynote over here at HISA was "Winter is Coming."
I love the Game of Thrones.
And so, again, we know that bad things are happening, and we're looking the other way around. And the same is true for the biggest part in healthcare. We're looking the other way around. We think healthcare is special, we are special in the things that we do. The reality is that like 80% is logistics indeed, where the patient is in need of getting to the physician or the nurse, and that also is going to be transferred by technology. So yes, we're a bit in neglect. We're looking the other way around, keeping hold on regulation and reimbursement systems. I've never been able to catch whatever government is preluding to the market. So it's the other way around. The market, as in the patients and citizens, will demand different regulations and demand different payment systems into it.
Now, for those in the industry, you expressed to me you're concerned about whether or not the workforce is prepared for this.
Yeah.
So talk to me a little bit about what you're worried about.
So I don't think that the workforce is not prepared. I think that there's a huge problem in terms of the amount of workforce that we have. We have shortage of skilled personnel. That's one. Second of all, if you look into the news nowadays, watching the news or the newspapers or on the internet, if you would be 14 or 15 years of age and would have to choose a career, nobody would choose for healthcare based on all the news that's coming out of there. On the other hand, people who have to, for 4 or 5 years prior to their retirement, are leaving early because they say, I've never studied to become a data clerk, because that's the other problem into it. So based on that and the doubling on healthcare demand within the same budget, we're facing a very steep curve and problem in terms of healthcare workforce. We need to train people differently. We need to embrace technology for the good for them and to make their job easier as opposed to more tough. You know what they're saying about this death by 1,000 clicks on a day.
Yeah.
So we really have to be mindful of that.
Okay, last question for you. Do you have any big bets on who of those tech companies or some of those outside players might disrupt the system once and for all? Is it somebody who's out there already, or is it maybe some newcomers, some upstart? What do you think?
Well, I think it's both of them. I really think that some of the big companies that are betting right now will be in the game. But let's also be honest, in the Fortune Top 500, there's a lot of companies that didn't exist 4 years ago.
Right.
So maybe it's a new couple of guys and girls that are working in the garage, doing interesting, fancy stuff that all of a sudden pops up and will change it.
Awesome. Well, Lucien, it's always a pleasure to talk to you. I love hearing your vision for the future. Thank you so much for joining me.
Thank you again.
I'm Jessica DaMassa with WTF Health here at the HISA studio in Australia. Thanks for joining us.